Hi everyone, I'm Ashifan Raziza. I'm from Bachelor of International Service Industry Management, and then now I'm about to presenting about my research, and then maybe you're curious, so let's find out. So my research is about redefining vital harmony of intelligent service robot. So this is the robot, and then we'll talk about how is it going, and then what is it about. So let's get started. We have talked before about this, and then what is the robot, and then why am I doing this. So let's take a short talk about this. So the core problem is I divide it into the challenge and then the mandate. The challenge is I want to build a robot, put a simple and then a unified robot, integrate process, and then for the mandate is I want to build something really useful and also reliable, and then it's also helpful. And then so the reason why I do this is because I have my reason for doing this research, because during my time I was hospitalized, and I saw the separate what we say that the temperature, the body temperature check, and then for the other fetal harmony. So I want to make a robot unified robots to make it better, and then so it's not really wasting time. And then let's talk about the research I do. So at first, before doing this, before making this robot, I also did the quantitative research. So I was doing the questionnaire. So I was given 62 respondent. Actually it was 65 respondent, but I just picked 62 of them because they have real interaction with the hospital robot. So what is what is happening there? So I did the quantitative survey of 62 hospital users, so also analyzed with SPSS. So the reason is I give them the question what statistically drives the satisfaction with service robot, and then it turns out to be the critical finding. The first one is perceived usefulness with the beta 0.42. It means the robot must solve a real problem. So this is the most important part. And then the second one is the service quality. The beta is 0.38. So it must be reliable. The robot must be reliable, and then also professional. And then of course the third one is easy of use. So at first, the first one the most important thing is about the perceived usefulness. And then during my research, I did of course I have the scope and then the limitation, and then for the scope about what I did with my robot. The first one it's proof the integrated workflow concept. So it validate user interface design, and then also it already tested core functionality with the temperature, and then the simulated pulse or heart rate, and then demonstrated cost and effectively for the prototyping the robot. And then the important limitation, of course there is a scope. There's also the limitation about what I didn't do. I have to claim that this is not a medical device, of course, because I just developed it, and then it's not approved clinically validated by hospital or by the healthcare clinic. And then of course it's limited sample, because I just have 6 people around me to test it my robot, and it's not really that big example. And then of course later we will see what will happen, and then what can we do with this. And then are you curious about how this robot is functioning? So let's talk about the step to step with the robot. Later I will tell you more about this. The step one is the screen will show the welcoming words, and then the second step is this is we will make this keypad here to enter some data. And then the step 3 is measurement. Here are the sensor, and then after that it will show you the analysis, and then yeah, it's done. Let's talk about that later. And then yeah, of course, like this is I name it Balbo robot, and then I use like some hardware, and then like here it's the LCD with backpack, and then inside there's a DF player mini, but like, unfortunately it's for now like it's not really developing, so like I can make it now. And then also like we have like this is the sensor, infrared sensor, and then as the brain of the robot, like we have Arduino here inside of the robot. And then so this is like the table like for the testing, pilot testing for my robot. So there are 6 people that already tested the robot, and then like this is like I named them like participant, and then like participant 1 until 6, and then like they entered the age here because like all of them like are my friend, and then like it's limited, and then the temperature one, and then like the heart rate, and then like the cycle time, like in how many minutes or how many seconds like they are doing this. And then yeah, of course like they leave the notes. So yeah, so this project has demonstrated that evidence-based design leads to practical innovation by surveying hospital users and letting the statistical analytic guide our priorities. So right now, let's do the practical for the robot. So I have this like this is like USB. So actually like the robot must be connected with the laptop or a PC. So here I will connect it. You see like big the blade here, like you already see like the LCD and LCD backpack here, and then it must be like, of course like they must have like power supply. So I use the power supply with the electricity. So I put in the electricity, like you see that this is the welcoming, this is like the welcoming greetings and welcoming words, like this is the, so they have like instruction at first, like when you turn it on, the message here will be the instruction. So this is the keypad, like so it will have real instructions. So at first like welcome to Medical Balboa, and then I put my student ID here, and then like this is like the keypad. So like here instruction A for enter age, B for enter weight, and then C like to see the result. And then so I use like also like the SSD card. So the data that already taken by patients also can be saved, not manually not manually by writing them. So yeah, let's demonstrate it. So at first we enter age, here we press A. So like it's limited like just the age until 99 years old. So I will put my age here 21, and then after that we press hashtag here, and then we next like we press the B here, and then after that I put like the weight in kilograms. So I put my weight here 67, or you already know my weight then. So yeah, here. And then after that I use the sensor here. So it's contactless sensor, so about like 3 until 5 centimeters it detect. Yeah, it's already detect. So after that, like detect the temperature, I just put it here because like all of them are the sensor. Yes, so this measurement is temperature, and then the heart rate. It will show if you type like the C. And then after that, wishing you good, thank you for using system. Okay, so let's put here, and then they will starting health check, and then it will show you the temperature, and then the advice wear more clothes because it's really cold here. And then yeah, after that, okay, let's after demonstrating this, I will show you the inside here, and then before that I will show you yeah. So I'm coding the robot with Arduino here, so like it means like I included the wire and then the crystal, and then oh yeah, so I will open this, and then like actually like I tried several times by coding in the Arduino. Yeah, so because like sometimes like of course like we will have error, and then of course like with this also we have error, and then like I'm using the Arduino for because like the hardware I also use the Arduino, and then the software like I use the Arduino because like all of them are like the brain of the of the robot. So wait a minute. Actually it needs a lot it needs some time. Yeah, so let's see, like you're curious about what is inside. So this is like the inside. Actually like it must have like the power here for the MP3. So this is like the battery. I use this one battery, and then actually yeah, this is the sensor. This is the two sensor that we use, and then here it has the speaker, but unfortunately like there is error, so I cannot use the speaker right now. And then like you can see here, this is the SSD card, so it saves the data of the patient. And then like here actually like later like I will check again about the data. So this is actually like the what we say that the speaker, so like it has voice function here, and then if you see here there's resistor, and then yeah, so this is the Arduino one, so this is the brain of the robot. And then like you see here, like I use like different color of the cable, so like this one, this is like Mr. Out, Mr. So like the here, like you see the red color here, the red color is like the VCC is power supply, and then GND like generate, and then of course like I use different color to make me easier if I connect them. And then also here the Arduino one. So I think because like of the limitation for our presentation, so maybe like we will talk again later. So this is my presentation, and then this is me, Ashifan Raziza, with my medical bubble robot here, connected with the laptop, and then connected with the electricity also, and then bye bye.